Hello everybody, Jim Bostock here. Welcome back to my channel to watch this video. Thank you so much for all your support. This video is going to be on your shoulder. How many of you out there are chronically living with shoulder pain? You are watching so many videos here on YouTube and other social media channels, AI, to help you and your shoulder. You're doing the best exercises for your shoulder, all the remedies and tricks and hacks for your shoulder, but the pain is not going away. In fact, it's worsening. It's worsening for you. Injections, cortisone injections, steroidal injections, PRP injections, so many injections into your shoulder, and it's not improving. You check out surgeons. Surgeons need to have a look at this. Something is really wrong. This is not in my head. I'm not going crazy. My shoulder is really, really painful, and I can't do what I want to do in the gym, in the pool, with my sport, general life, putting clothes on, putting my jacket on. This thing is annoying, and I can't sleep with it. Every time I roll on it, oh, there it is again. It wakes me up. It's ruining the course of my life because the pain isn't going away. This chronic pain, and I hate that word, chronic pain. I'm just being thrown medications to numb the pain, and I know deep down this is not the truth for your shoulder pain. How many diagnoses have you been given? Shoulder bursitis, shoulder impingement pain, labral tears, muscle partial tears of your rotator cuff tendons and muscles and so on underneath this space here called the subacromial space. But the surgeons have had a look at you and they're saying, no surgery needed. Maybe another cortisone injection. Keep doing physiotherapy, your chiropractic, your exercises, and good luck. Bye-bye. You're so frustrated, you go to another surgeon. I've met people who've been to multiple just to get an answer. And drastic maneuvers, people get surgery. They open it up. Ooh, I'll do a little clean out, but nothing really sinister going on in there. Close it back up. A few weeks later after recovery, your pain is still there. Is this you? Are you getting so frustrated with this problem? I call it nerves that are locked in your shoulder. Think of it this way. When you first traumatized your shoulder, how many months, years ago? Nerve locks kicked in. These nerve fibers that sit in your muscle fascia around your shoulder, going into a protective mode, locking it down. They sit all in your rotator cuffs. They sit in your pectorals. They sit in your lats. They sit in your deltoids on the top, the big top muscles. They sit in your traps. They sit between the shoulder blades, between the scapula and the spine. They sit there as a protection mechanism. And the more you do things to the shoulder that aggravates these nerve locks, it makes it worse. The more you do to aggravate the nerve locks in the shoulder, it makes your pain worse. Now, what is that? What are those aggravating factors that makes this so much worse? One classic one is deep tissue work. Anything deep tissue, deep, painful massages. Get in there, please get in there. Aggressive mobilizations to your shoulder joint that can happen from manual therapists. Injections, yes, even injections. The surgery that may not have been necessary, yes. But why injections? Well, if the shoulder joint is not sitting properly, let's watch this. Look at the shoulder butting up against the bone at the top here. Look at that. The glenoid, this is the glenoid, right? The shoulder joint inside the ball and socket. The ball butts up against the top bit here. The subacromial space, it's called. I'm sure you know that, the subacromial space. But have you heard this? Where the bone butts up against the acromion, right there. And it's in this space that sit all the muscle tendons, the rotator cuff tendons, like your supraspinatus, infraspinatus, right? You hear about all these partial tears. You hear about shoulder bursitis. You hear about it, the subacromial bursitis. What if this space is so compressed like this, so compressed, jamming everything? Every time you move your shoulder and try to do things, the shoulder feels jammed, right? Do you feel that? It feels jammed and locked in this position. Think of it this way. Imagine getting a blister in there all the time. Because every time you move the shoulder in every which way or form with the best exercises that you're doing, all the TheraBand exercises or rubber tubing exercises, and even, as I mentioned, cortisone injections that went in there. What if this bone is still stuck here? So let's say the injection went in, and it's gone into a very compressed and aggravated joint. Do you think that steroidal anti-inflammatory medication will do its best work? My thinking is no. That's what I see. How do you feel? I would think no, because the space is so compressed and jammed. But it's much better when the space is open and free and decompressed. The injection will theoretically work better, right? Even your exercises, all the exercise that you're doing, what if the space is much better, decompressed, more free and open for the exercises and the muscles to help? That sounds better, doesn't it? Well, that's what nerve blocks are really about. When nerve blocks lock in, as I say, as a protection mechanism, when you traumatized your shoulder months, years ago, that very first moment in time, that incident, it did this. It locked it in like this, and it has not shifted from there for years. Even though you're trying your best, it has not shifted. All the therapies, all the injections, it hasn't changed the status quo. Some of you, the injections may have helped round 1, but then round 2, round 3, nothing's working. Why is that? Because the status quo is still there. The common denominator is the ball in the socket is still jammed. This impingement scenario, right, that you've been diagnosed with. How does it jam like this? The nerve locks around the muscles and in the muscles that I talked about earlier, they lock down to protect and shorten everything, and hence they lock it in, jam it in to protect and preserve this area from future harm. But we need to use this shoulder. We need to go and live our lives. We need to do our sport, go to the gym. This ball and socket will not allow you to do that. When the nerve locks are managed better and smarter or treated, the ball drops down like this. And then we have something to work with. Yes, and you actually can get progress and improve your shoulder pain from being in this bad state that it's in currently. That's what nerve locks are about. It helps the shoulder sit better in the socket. That's the key. And it's from here that you can start to do all your beautiful exercises for the scapula, stability, for the rotator cuff, for the muscles around it on top. That's when exercises work their best. But it has to be in the right position, right here, first. And nerve locks are important to manage first. But the problem is, many of you watching this will have never heard about nerve locks. It doesn't exist in the literature because it has been my personal discovery in the last 20 odd years, treating thousands and thousands of shoulder. I discovered nerve locks. It's been my own journey, and hence I'm educating the world today. Thank you for joining me here and listening to this, because this is you. You've tried everything, and have not even heard about nerve locks until now. This is a special time for you because nerve locks are your way out of this horrible shoulder pain state that you're in. There's so much more information about nerve locks that you need to know. Today, it's about the aggressive stuff, the painful massages, the deep tissue, the aggressive manipulations in your shoulder that you must stop doing. You must stop doing. I'll give you some more tips right now. You have to stop doing those TheraBand exercises. Yeah, the TheraBand exercises that you've been given, the rubber tubing exercises, they are actually making your shoulder pain worse. Most of you, a lot of you, I believe 100% of you will agree with this if you're watching this video, because you're trying them, and yeah, if you're really honest with yourselves, they're not helping at all. They're actually making it worse, or they're not changing a thing. So I would suggest you stop them, because nerve locks do not like those exercises. It's that simple. The muscle systems are not sitting in the right nervous system state for those exercises to really help. They actually make the nerve locks protect you harder and longer. It fuels the problem. So please stop doing that. My suggestion is more gentle stretching. Gentle stretching, keyword. For your chest muscles, your chest, your lats, under your armpits. And foam roll your thoracic spine. Foam roll this. I've done so many videos on this here on YouTube and my other social media channels, so please have a look below on all the links for Instagram, TikTok, Facebook. It's all there. More exercises to help stretch gently. Pecs, lats. Foam rolling your upper spine, your thoracic spine. Foam rolling this part here with deep breathing. Rather than causing more pain, which fuels the problem, more gentle stretching helps this immensely, because with the gentle, frequent stretching, and I recommend up to 5 times a day, you're helping this ball sit easier in the socket, more decompressed. And as I mentioned earlier, this is the right scenario for healing. If you need an injection, again, if you recommend it, it works 10 times better when the ball is sitting better in the socket, more decompressed. Hopefully you won't need another one. You do the right exercises and this goes away. You get the right treatment and this goes away. There's so much information that I've put into the Nerve Lock program for shoulder pain, chronic shoulder pain. The link is below. It's called the Healing Vault, the new platform that I just launched a month ago. Super excited about it. So many people are joining and changing their lives for the better, finally getting their shoulder back. There's programs in there for various problems, but the shoulder one is a doozy. It's really, really helpful. Just launched it. The link is below. It's called the Healing Vault. This is the reason why your shoulder pain is still ongoing and no one's telling you the truth. It's right here. Please ask me some questions. Comment below. Tell me your story about the shoulder. Click on the links and have a look at the Healing Vault. The programs in there will help you immensely, will help you so much. I can't emphasize it enough. So if you want to get rid of this from your lives, please come and join me. Thank you for your support again. Please click like and subscribe. Please share this with your family and friends if you found this information really, really helpful. And I look forward to seeing you on the shoulder program, and let's work together to get rid of this. Take care, everybody. Speak to you all again soon.